Hi everyone, thank you so much for joining. Straight off, apologies from our side for the slight delay on our part, but we are here now and we are here with a very fabulous panel as you can see. So I am Shivani Roy and I have worked at Lead Square for quite a few years now, and I am the director of marketing here. So again, thanks so much for joining the roundtable. We hope it's a very useful and insightful session for you. And I don't see a reason why that can't be the case when you have speakers like Mr. Harsh Trivedi, Mr. Suresh Ramu, Dr. Sanjay Pandey, Dr. Raj Gopal. So before I get into their introductions, I'll tell you a little bit about what you might learn about today. So we're talking about building patient trust in the digital age. We will discuss certain proven strategies that might help you win online trust. We will of course talk about data security and privacy, because when we talk about the digital age, you can't not talk about data security. And we will also talk about the power of a trustworthy digital healthcare environment. So, a little bit on our speakers today. So, we have Mr. Harish Trivedi, who is the Chief Executive Officer of South Asia American Oncology. We have Mr. Suresh Ramu, who is the co founder and CEO at Site Hospitals. We have Dr. Sanjay Pandey, who is the Chief Executive Officer of Lifecare Hospitals Group. We have Dr. Raj Gopal, who is the CEO of Chandan Hospital. And last but not the least, we have Shraddha Somani, who is the Director of Key Accounts at Lead Squared. I think she is held up. So until she is back, I will sort of go ahead with the session. So my first question is for Harish. So Harish, as a result of the traditional trust between doctors and patients, which is a challenge, how do you think organizations are handling this changing dynamics and reaching the potential patients amid digital chaos, so to say?
Thanks, Shivani. Shivani, we need to understand, and now I defined healthcare as a pre-COVID and post-COVID. Post-COVID, we have seen a lot of changes which is taking place digitally and overall the way healthcare delivery is happening, and it is going to change going forward. We have seen the people or the patients in general are more aware about their health because of the one is the accessibility of the data, information available online, and they are more aware about everything which is happening around them. So I think patients in general are more aware nowadays. And if we have to talk about the how the digital space has impacted the overall relationship between the patients and doctor, then we need to see, first let me talk about the positive impact. So what is happening is the from the previous time to now, we are seeing the increased engagement with the patients. That means patients are more informed about their health condition, treatments, preventive measures. So they are well about their health. They are reading a lot of stuff online. And once they have more information, they are engaging with doctors, asking a lot of more questions about it. And once they have this, they feel more empowered and feel they are autonomous. That means patients feel they can ask more questions, take a right decision about their health, and this comes with a lot of responsibility on the doctor's part. The third thing is because of this, timely and early treatment can happen. Since patients are more aware, they are going for preventive health checkups. So this has created a lot of awareness, and because of this, there can be a lot of early diagnosis and treatment of the diseases for the patients. So that can be a positive impact. If I have to talk about the concern area because of this awareness and overall digitalization of health is happening, is it is creating a lot of challenge to a doctor's authority in a way. Once patients have a lot of information, they have a lot of questions, they have a lot of feedback, they post a lot of feedback, and this creates a lot of conflict because not all the informations they have online is correct, and based on some half-baked information, they questions the doctor's authority at times. The another is the time management. Now we know because of the evidence-based practice and the digitalizations, doctor have to spend a lot of time in documentation, right? And because of this, they could spend little time with the patient interaction. And since the patients are more informed, they want more time from the doctors for the consultation. So this creates a lot of problem for our doctors to manage their time properly. And I've already discussed about the quality of the information. Not all the information is right, so that may create a lot of confusions and a conflict between patients and a doctor. And this creates a lot of anxiety in a patient. Once you don't have the correct information and create have a conflict with the kind of a conflict with the doctors, then you are more have anxiety about your health and what is going to happen to you. And overall, I'll put it the expectation management from the both the sides. Patients have a lot of expectations regarding the time, more information, and similarly, doctors needs to manage the expectation of the patients, because patients is the key at the end of the day. So a lot of patient and expectation management which is going on. So put it in, I have to summarize all this. The access to health information has led to a lot of informed and engaged patients discussion, but at the same time, it has created a lot of challenges which requires a careful navigation and decision making with the patients. So these are the kind of change we have seen. What to you?
Okay. Thank you, Harish. Raj, this question is for you, Dr. Raj. In India, where a significant portion of the digitally active population resides in tier two and tier three cities, how are healthcare organizations reaching these patients and building trust?
Uh, Again, I completely agree with what Harish has said, but still, a patient, in spite of having all the information at their fingertips, they still want to meet a doctor. At the end of the day, they still want to speak to a doctor. So I think a lot of trust of the technology sector is going into creating a space between the doctor and the patient, and I think that is a little bit of a problem, because the patient would always like to sit with the doctor and discuss their problems, and the closer they are to the doctor, the more more assured they are of what they're getting as a treatment plan. And I would feel that bridging the gap between the patient and the doctor, there's only one way to do it, and that is to become very transparent. So, with the information that the patient has, the doctor also has a lot of information. And the doctor's information comes, it is not from, I'm sorry, can you hear me?
Yes, yes.
Yeah, the doctor's information doesn't come only from theoretical knowledge. It also comes from their experience in the work that they're doing. So it is very important for a doctor to, because the doctor sets the tone of any meeting between a patient and a doctor. So I think it's very important to remove the digital and the tech part and then talk to each other. I mean, that is what I feel is starting to move out from practices. We're becoming so, dependent on technology. There is a space which I can speak about. But right now, to engage, the first time that you engage a patient is to speak to the patient and then let this patient speak to you. So let them come up, because see, a patient who's coming to you has got a lot of preconceived notions, and that they have, they've been a barrage of media, glare on how doctors are not very good. So they come with that, and then it is your job as a doctor to dispel those doubts. That's the first thing, is to set the tone, and the setting the tone cannot be done digitally. It cannot be done by tech. It has to be done one-on-one. So that's where you start the engagement. After that, you can bring in whatever technology you want, whatever you want, because once the patient starts to trust the doctor, then the patient is also open to everything that the doctor says. So the first thing is to be transparent, and that's how you engage. Even because in tier two and tier three cities, or in tier one cities have more access to, yeah, a larger audience, a larger digital footprint. Tier two city, tier three cities, towns, they don't have that much of access. So it's easier to engage with them as person to person, but then you can bring in your tech in other places. Like for us digitally, if you're looking at it, I would rather suggest, instead of investing in, say, telehealth and things like that, it is much more important to invest in having proper documentation, having, like your hospital management systems. Invest in that. That is also technology, doesn't require very high end technology. Now it's very prevalent. So in the digital age, I feel that might be making a little bit of an error trying to go too much into, high tech AI and whatever, all that. You can talk about all that, but if you don't have your basics right, you don't have your hospital management systems right, you don't have your records right, you can never give optimal treatment. You need, like, for example, cancer, where Harish and I think Suresh work in. You need patients are there with the doctors for years together. If you don't have previous records, you're basically running blind. It doesn't matter how much information anybody has from the internet. If you don't have previous records, you're not doing much. So invest your hard-earned money into technology which is available to keep your records. Things like that. So, if you don't engage at that level on one-on-one, I don't think you can ever engage a patient between a doctor and a patient.
Thank you, Dr. Raj. Sanjay, moving to you. As a CEO, how critical do you consider the role of patient engagement and trust in driving the overall success and the top line growth of your healthcare organization, especially amidst the current digital landscape?
Uh, Thank you, everyone. And I was just here hearing Mr. Haris and Dr. Raj as well. And there are a few things which the Mr. Haris has mentioned, that the digital media can work with more engagement, and it has its own concern. And this concern I clearly see in Dr. Raj's statement, that unless otherwise we have the one-on-one conversation, have our documentation, basic things right. So how to reach tier 2 and tier 3. I'm very happy to see that everyone talking about the larger group, tier 2 and tier 3. See, I have been practicing as a clinician, now I'm a CEO. I have seen there are certain things which is the concern at the both level, whether you go for digital media or whether you go for the one-on-one conversation or between doctor and patient. Look for that like a communication barrier, as Mr. Haris has mentioned. See, the communication is always a issue, because the doctor who studies who is having a different background, as I say, Dr. Raj is there, who has moved in different segment. I have been practicing in the Tamil Nadu. So always the language is the one which creates always a barrier, whether it is a digital or whether it is a one-on-one. Second thing is, we also need to know that what health literacy status of the patient's background. Whether the patient is coming from the rural area or urban area, it matters a lot. Third thing is the cultural differences. If I tell you that the cultural differences is some of the patients which I have seen, which comes from the not only from the India, I've seen the patients coming from Nigeria and all. They do not express themselves completely. They have their serious concern. They want to see the doctor, but they don't want to express themselves completely. And this is the one thing which was mentioned by my previous speaker about the transparency from both the end, not from one end. Number four is the time constraint. Now, most of the doctors, you know that if you have a lot of time, so you don't have patients. When you have too much of patients, so then you give a very shorter appointment. And shorter appointment, patient want to tell you the story right from the chronological order. Patient want to say, as the book says, chronological order, tell from the beginning how it started. And I think all of you must have seen it. But doctor said, okay, tell me, where is the problem? Right? So there is we need to also know that this time concern will not improve whether it is one-on-one or digital, unless otherwise we provide a proper time frame to listen the patient, understand their problem, because no matter what is the information available through the different investigation program, but whether it is online or whether it's one-on-one, if we don't give sufficient time and we don't listen to patient, we always miss certain things. Because patient, as Dr. Raj has told, he comes with a lot of information, misinformation, mixed information, and he cook up the story, and he want to say something else, he want to hide something else, and you go by what he present, and then you miss a lot of things. So, third thing is that the trust issue, transparency, of course, required. If we suppose that let's go for the digital transformation, how we can utilize for the healthcare. So, first thing is first, it do lacks the some personal interaction, but doesn't means we cannot utilize it. We can reach to the patient at the more remotest area. Suppose that a senior clinician is available at Type 1 and Type 2 city. Some of his patients is want to have a consultation with him just for follow-up. All the way coming from the Bihar to the Delhi or Lucknow may not be feasible for just a simple consultation, where it will be more feasible that patient can share, okay, sir, this is my latest parameters are there. Shall we continue this medicine or shall we not? But the initial communication, initial major diagnosis, personal is more efficient. But when you look for the further follow-up, for the shorter discussion, for the certain information which you want to clarify, I feel that digital is more useful and it can give you the better reach to the patient. Second thing, also we say that when we talk that patient should be at remote area, meet the patient and a doctor in tier 2 and tier 1 city, then the technology will be a big barrier. Second thing, cultural difference, what I already mentioned, which will make a privacy concern. Patient will feel that shall I share my details or not? I don't know these information are going where. I don't know whether doctor is seeing or someone else is seeing, if they are sharing with some other patient. Fourth thing is that interpersonal communication. Overload of information, which already we have mentioned that patient comes with a lot of preloaded information and which link and cook up with his own story, which may not be true. Fifth thing is that a lot of legal and regulatory issue, we cannot just like that share the details, because Dr. Raj has also told we need to have a complete documentation process, privacy, security. We cannot openly in open forums share it. Then, if we look for the personal level, suppose that a patient comes to me and the patient comes from far away. At personal level, here is the advantage of digital that patient may come one time for a major surgery, but he may not come for the next 6 months or 1 year, every month or every 2 months for follow-up, where the digital has a upper hand and very good advantage. Cultural barrier is plays a major role where in digital area, when the patient comes 1:1, there is an emotional connect, there is empathy. You talk to the patient, you understand, patient open up. But when you go for digital, the patient shares with the people around him, and this cultural and language barrier stops a loss of information. And there you may have the half information, cook up of information, or it may not work out. Third, and the last part is that health literacy. When it communicates to patient 1:1, you understand his geography, you understand his health literacy, and you modified your communication skill. But in digital, the time frame is there. You are linked by the technology of the two sides, where you may ignore this point. So, which I felt like we have to little improve our system to have a hybrid system where the both is, I cannot say this is better or that is better, but as a business part, I say, so for me, the hybrid works out very well. If I tell you one thing, if a patient is serious, it is there in nursing home XYZ. And now this nursing home patient is having a certain limitations of level 2 or level 1 maintenance of the ICU. Now they want an expert. Now they don't know where to send it. If suppose that we have a communication of level 3 or level 4 ICU expert, he talks, he sees the patient, he advises to do certain thing. At one point of time, he said that maybe you may have to take a decision. So that time, the patient get benefited, even those small nursing home get benefited, and we also creates our reach to the smaller town where we may not physically reach, but we can help the patient either digitally, or we may at one point of time tell the patient to physically to please transfer the patient to our facility, and we can give him a higher end treatment which may not available at that locality. Fourth thing is there, it's not necessary that for every small disease, patient has to go to a bigger facility and spend. See, if suppose that you are traveling from the Bihar Patna to the Delhi, you will not travel alone. You will have a two attender. They have to stay, their food, their travel, your treatment, and then you wait for 10, 15 days, then you have follow-up. So it's not necessary for every small thing we need to travel. So digital media can be utilized to have an initial conversation, initial discussion with the consultant, and he decided that yes, at this point of time, I think that you need to come for 1:1 personal communication, and let's have a plan for the decision. Both party can plan well and they can move. So in that way, the patient's cost is reduced. Similarly, our bigger hospital reach to the smaller town, even the remotest village, is possible. And it's not always we have to go by the telemedicine and all. We all create portals, we all create the certain mobile app where the patient can book the appointment, patient can communicate to our doctors, patient can load the information, and patient can just pay the standard consultation fees alone to take a decision, shall I move or not, right? Suppose that some patient has got the some major disease. I don't want to mention anything here, and whether he don't know if this hospital is the right place or not. He can talk to the consultation. He can just pay standard consultation, which he can pay in his town. And he have a consultation. He get a proper guidance. Doctor also know that what patient I am getting. And then he decide that, okay, fine, whether you have to come one time, you have to come for the longer period, or you have to come for shorter period. So he can give a complete plan where the patient can decide when to move, how to move, and what will be his expenses. I think it's both way it works well. But I am always sure that either of the model 100% will not be. It has to be a hybrid model. That's my view.
Thank you, Sanjay. Suresh, this one's for you. So, in marketing, we often talk about the four stages, that's awareness, consideration, decision, and retention. Similarly, in healthcare, a patient engagement doesn't end at consultation. So, how important is it for healthcare organizations to actively listen and engage with patients even after the consultation?
Well, I think the points made earlier, and thank you for very much for inviting me to this panel, first of all. But I think the points made earlier are extremely relevant in terms of what you're doing to build trust first. Because if you don't have trust, the conversation really doesn't go forward in the minds of the patient. So I see this in two parts. One is the patient is asking the question, is this the right treatment, right doctor, right facility? That's the fundamental questions they're asking for themselves. Do I need to go through this? Is there anything else that I can do, which is cheaper, better, faster, whatever, right? So that's, I think, the fundamental question that patients are trying to ask in different ways and different priorities for different patients. The second is, how do I know that this is the truth? How do I see that? So that's about transparency that Dr. Raj mentioned and Sanjay mentioned and Harish also referred to in terms of the communication and the transparency that we need to create in this channel. So these are the two fundamental areas in terms of what the patient is seeking for, right? So they are actually asking question, what do I need to do? And then immediately after the consultation, they're also trying to assess, is this the right place? Is this the right doctor? Do they have the capabilities to deliver what I need? And is it affordable? Is it possible for me to go through this? Do I want to go through this, etc.? Right? So these are the questions in the minds of the patient. The time that we give. So the patient assesses the consultation in terms of trust achieved during the consultation, but the patient actually receives it as empathy. I think the patient is assessing empathy. Empathy for the patient is time spent, which was also mentioned earlier. So if you don't give adequate time, the patient feels there's no empathy here. If the doctor does not ask all the relevant questions, which is perceived as empathy or the time well spent by the doctor in understanding what the patient has, though the doctor may be fantastic. Some of our doctors are so brilliant, they can actually go through the records in 30 seconds, literally. And the patient expects the conversation to be at least 10 minutes to go through, because the patient would have spent probably an hour to put these documents together in the first place. So the perception of time versus empathy is, I think, the big thing in the minds of the consultant, in the minds of the patient. But post consultation, the patient has a lot of questions, because during the consultation, they probably have not been able to ask all of these questions. They're probably taken aback, or there's an information overload that was also mentioned. So if we are able to provide this information to the patients over a period of time after the consultation to allow them to digest and absorb this, we often see the effectiveness of this being very, very high, right? So everything cannot be achieved in the single consultation, assuming even the time has been given. I think the patient and the family needs time to absorb this. And therefore, digital tools in this regard can be very, very powerful, right? So can we, first of all, provide access to their health records, provide access to what happened in the consultation, access to what the doctor felt about what the patient needs to go through, and then explain the terminologies that are being used in sometimes these prescriptions or the doctor notes, which often the patients have no idea. By the way, I'm not a doctor, I'm an engineer MBA. So often I get questions from patients who are connecting to me saying that, can you explain this? And being in healthcare now for many years, I can explain a lot of these terms, but very often we have to actually ask, Google, and ask the doctors and say, hey, what did you mean by this? And go back to the patient saying, this is what it means. This is what the doctor wants you to do. This is the next step. This is why we think it is important for you to do this. So those conversations are absolutely critical to build the next step in the treatment phase. So I think the other thing is sometimes patients, especially in cancer or some of these chronic diseases, or where fear is very high or stigma is very high, patients want to rush into treatment. And diagnostics sometimes is given less priority because of the fear factor, or the time taken for waiting for results from diagnostics, right? Again, here we need to provide that information that nothing is going to happen in the next 24 hours. You can wait. It's not unlike an acute event like a cardiac event where immediate action is required. You can wait, do the right diagnosis, check out the biomarkers, check out the various things that are options available. So to demonstrate this, we often think that a tumor board or a multidisciplinary team review that can be showcased to the patient is very, very powerful. And again, if digital is available to showcase that, the level of trust that the patient gets is very high. But let me stop at this point and give it back to you.
Thank you, Suresh. Now, switching gears slightly, let's talk about the tech behind these processes and practices. So, Harish, this question is for you. What other specific technologies can help streamline communication and operations to ensure that the right information reaches the right people at the right time? So, how can we effectively deliver timely information?
Okay, so before moving on to answering this question, I'll just touch upon one very important aspect of the previous discussion. And we discussed about the patient and doctor relationship, and what we all agree that what is very important is the communication. But unfortunately, in our medical colleges, they only teach medicine and not about the communication or the importance of the communication. So maybe it takes a lot of time for some of the doctors, and eventually I've realized, being in healthcare, so being a non-medico, I've realized all the clinician who has got a roaring practice, they have an excellent communication skill. So maybe I have raised this issue and in some of the forum where there is a need to explain the importance of a communication to the young budding passing out doctors. Okay, coming to your question. I'll broadly see there are a lot of tools which are currently available, and we all understand the importance of the tool having the capturing the data and how it can be utilized effectively for the patient treatment and the efficiency. And from the if I talk about from the provider side, how can be utilized to maximize the efficiency, RPOB, and a lot of importance. I broadly I'll touch upon what. So I have a very good friend who's the additional CEO of ABDM, Ayushman Bharat Digital Mission. And I tell you because I don't want to talk about the specific tool which is available in the private space. Let's talk about what government is creating and that can be useful for everybody. So Ayushman Bharat Digital Mission is one of the fantastic initiative taken by the government of India, and where like when we register ourselves in a healthcare facility, we get a unique UHID. Similarly, I don't know how many of the people on the platform or right now attending this have a ABA ID. So if you go to AVDM portal, they will give you a 14-digit unique health ID, right? And this can be used everywhere. Second, what this portal is doing, they are providing a registry for all the healthcare professional. It also provides the repository of the health, all the service provider also, professional and provider. So that means you have the entire ecosystem now available on the single platform, and you have a UHID. So you can register yourself and share your clinical or records which you have and store it. And what you can do, and apart from this they have created a standard API so that can be integrated in any app or in HIS system. So it can create a lot of interoperability between the different health IT system. And like we discuss about the lot of security concern. So on this, you have a complete ownership of your health record, and you can share with the consent. And the consent is very important. With the consent, it can be shared anywhere. So right now, but there are not a lot of awareness, and I see a lot of hospitals or healthcare providers are not even registered with ABDM. So I'm sure government is working on this aspect, and there will be a time 2 to 3 years down the line where everyone will be have a one unique HID, UHID, instead of having the hospital given the UHID, and this with this they will be able to manage and share their health record. And once you have all
I
this
think
data, yeah, go ahead,
I
sorry.
think they have given the earlier timeline in the 2025 end, but I think they have extended it and they have not given any particular date.
Yeah. So in my private conversation with that person, this will take another 2 to 3 years down the line. But the way we are moving in right direction. Every month you see there is more and more healthcare providers are coming and getting themselves registered, and government have started also giving some incentives for doing this. So that's another good step taken by the government. So what will happen once you have all this data at one place, health record at one place? Right now, we are seeing a lot of time taken in settling of the lot of insurance claim, or even if the claim with the government, it takes a lot of time in settling the dues. So with this, everything available at one place, and creating a record, health history, it will become very easy and convenient for the claim processing. So I'm sure this will further improve. Apart from this, there are a lot of challenges will come in place. And first challenges is adaptation of the system. And as like I said, a lot of awareness needs to be created. And once we have a single platform, like we know the benefit of UPI, this is again will become very easy. Another concern is security concern and a privacy concern. I can give you example to check the robust system or how fantastic our security system of a data system. We invited few hackers from Ukraine, and they did try checking out some of the best hospitals website, and it was not secure, and they could access the data very easily. So everyone needs to focus on this aspect, which is a privacy and security concern which we have at this point of time. We keep getting the message, a lot of data leakages which is happening. When we have this kind of a system eventually, so this will take a precedence, and this become very important for all of us. At the same time, we have a lot of limitations at this point of time, even if we are talking about the accessibility of the data or a connection in the rural area, even if we are talking about the digital platform. In the rural area, tier 3, tier 4, we still see some of the issues, and we need to build a lot of infrastructure. And while doing this, I don't see adaptation from the even the illiterate people or semi-literate people to digital platforms. So I was hearing one of the argument coming from the side is, yeah, this can be a challenge, but I don't think this can be a challenge. If people see a value for money, I'm sure people will easily adapt, and that's the reason we are saying nowadays even the security guard seeing the movie on OTT, or even the remote area where the small farmer or a vendor are dealing on UPI. So it is all about the value for money. If the people will see, I'm sure they will adopt. And instead of looking for any other tool, I think going forward, all India level, we need one digital platform tool, and this can be a transformative change in the right direction. Over to you.
Thank you, Harish. Continuing with the topic about security and data breaches, Dr. Sanjay, this question is for you. Keeping in mind data breaches, how can healthcare providers ensure patients are receiving accurate and reliable information online?
So I'll tell you that in our Indian scenario, the healthcare is totally the evidence based. We are not like older. We are is a personal perception. Number two, the most of the hospitals, if you see current scenario, as Mr. Harris has already mentioned that though there are he has hired some hackers, but there is a most of the server they having the security system. So every hospital having their all their information. I think I'm talking about all the major hospital. They have a digital information. They may have implemented EMR not, but most of the hospitals they have scanned their information. They have a digital. They have their OPD, IPD files, and there is a continuity of the care is there where the all the information to the healthcare provider, the doctor having about the patient right from the day one, what are the chronological order treatment has happened, may not be from other hospital which patient physically bring, but for that particular facility, there is no information is missed, including each and every drugs and investigation. In fact, these information we have already provided on our website and our app where the patient can access their reports and all the discharge summary, all the lab reports, radiology. But of course, as you say, the security, uh, I think that we all having a proper security system, but of course, this security system, the level of security may not have reached to the stage where it cannot be hacked. Number one. Number two, this information right now we are taking it in the scanned form or the direct form, which is the many of the healthcare provider does not have encrypted information. Since these informations are not encrypted, these are the open information, and to getting encrypted at the small healthcare provider is not easy. Major healthcare provider, they have a larger chain corporate, they can create the format of encryption. But you know that healthcare information, if you say, it is not a one form. Certain things are in Word format, certain things are on picture format, certain things are on scan format. ECG, you cannot do anything else. You have to scan it and you have to upload it. And though these information are mixed information, so digital info still we need to work on it, that how to have a different format to be encrypted into the single format. If I tell you that if our communication, it is one platform, we have one format. If I share you a mail, it having one platform. But the hospital health record system, this having the all the formats, I will tell you that some of the doctors will record their laparoscopic procedure or interventional radiology procedures. They will record the videography as well. And this videography is mandatory for the at our level larger hospital where we feel it is a mandatory, because if suppose that tomorrow we need to show to patient, we need to show to the, or it may go to medical legal region, so we are recording it. Number two, many of the major surgeries, major parts or specific part we records. You look for the CT MRI, that format is totally different. Correct? Ultrasound, it is a different format, which is a static plus dynamic, right? And we also get a lot of other information, which is the system based, where the how we document at the different level. So it is easy to say, but bringing all into one platform, converting into encryption, disencrypt, and show to the patient, it's a large task. That's what is the Mr. Harris has told that even the task which is started 4 years back and supposed to complete in 2005 looks like additional 4 to 5 years it may take. But definitely we require a much robust, uniform, because continuity of the care is a big problem. Suppose that a patient comes to you. Now he is shown you may not be fully satisfied, or he's shown you for some other reason. Suppose you are a diabetologist, I do good treatment from you. Now I got a cardiac problem, I met Dr. Haris. Then I had some other problem, I met Dr. Suruz. Now the Dr. Raj is want to do the some procedure. He want to know that what the diabetologist has done treatment, what the cardiologist has done treatment, what is the Dr. Suresh has done treatment, and this information has to come to one platform, which is the necessary for the diagnostic procedure, but it is also the right for the patient to have a combined information. But again, this security, cyber security system or the digital security system, what we are talking about, it is the affordability. The patient does not pay for it. Organization has to bear it. Organization has to design it, maintain it, and share it. Right? And it comes at high cost. So right now, this is the reason, one of the reasons that we have a digital platform, but still the security levels of each organization are different. Some are still at level 1 and level 2, where is the just you can open it if you know certain password, or if you know the little bit hacking, you can do that. So definitely we have to go long way. It will not be easy, but that is nothing called impossible, because when everything can be put in one app and we can store it, then as well we can make it much stronger, safer, but keeping the requirement of the whole country database for all the patient, we have to also know that what is the bandwidth we require. And we also need to have the how the everyone can have access, even the service provider and even the person who is getting treatment. So it sounds easy, but I think that as Haris has told, it may not be so easy, and it may take some more time, and it will take a lot of cost as well.
Absolutely. I will now again come to our last section for the day. So, Dr. Raj, this is for you. We're talking about digital strategies in sort of building patient trust. So, in your case, how do you measure the effectiveness of these digital strategies? And if you had to give us, some of the key metrics that we should consider, and how do we track those?
Yeah. See, the first thing that we do with anybody that talks about digital strategies of patient engagement today talks about social media. And I think, again, we're moving away from what we can achieve as as a strategy to keep the patient's interests alive. And I don't think it involves social media at all. We have a very low tech tool which has been around for ages. It's called the telephone. You have to engage the patient by just calling them up. Ask them what their problems are. In our hospital, that's what we've done. Every IPD patient gets a call every day. And we don't give them a set piece of, like, is the room clean? Is this done well? Is that done well? We just ask, do you have a problem? And we let the patient speak. We let the patient's attendant speak. They might have a problem with, they might be, the toilet may not be clean. They might have a problem with the bed sheet wasn't changed today or something like that. It could be small, it could be large. My medication wasn't given today. We let the patient and their attendant speak. And we don't interrupt them for 3 minutes. That is our policy. We ask the patient, do you have a problem? We don't interrupt them for 3 minutes. And then that call is recorded and immediately assigned. We have different people, different departments that it is assigned to. and with immediate effect, somebody goes and meets the patient and addresses their issue. And it has to be closed by somebody in the top management. We have a process for that. The complaint has to be closed by somebody in the top management. So it's very simple, and it is it is using technology, but it is using the lowest technology that you can find. It's a simple telephone. Of course, we have a telecaller system which is attached to our our hospital management system. But what I'm saying is, unless you engage the patient after everything, whatever you do, the medical field is providing a service. So that service, the first thing that you do is you make sure that you are in touch with your consumer, which is the patient. If you're not in touch with the patient, if you're expecting the patient to come to you with their problems, it's never going to work. The patient is unhappy. If you go to them and ask them what their problem is, they are much more forthcoming. They want to tell you that this is how you can improve. And the second thing is, again, I go back to transparency, because I just feel that a lot of interaction between a doctor and a patient lack transparency now, because again, time constraints, like how Dr. Sanjay was saying, there are time constraints. Patients don't have the time, nor do doctors have the time. Everybody's busy, or the patient wants to take a lot of the doctor's time, which the doctor may not have. The doctor might want to take the patient's time, which they might not have. So you have very small time capsules which you can capture things. So the other thing that I would, in our hospital, what we have always try to do is two things for transparency. One is we ensure while the patient is being admitted, we tell them that at any point, because a big problem for a patient is how much is this treatment costing me. So a patient or their attendant. So we say that at any time of the day or night, 24 hours, our billing department is open. You can go and check your bill. We have running bills. They can check their bill at any given time. We don't say that you'll get the bill at the end of the day or end of the treatment. Nothing of that sort. While your patient is admitted, anytime, day or night, you can go and ask for the bill and we'll give you a running bill. That's number one. And then while giving the bill, we tell them that if there is any mistake, please tell us right now and we'll correct it. So the patient is being encouraged to read the bill, to understand the bill, and tell us if there is any deficiency that they find. That's number one, because that is a big problem for them. There are only two problems that a patient has. One is my patient getting the right treatment, and is my patient not being overbilled? These are the two major concerns in any hospital, even if it's a free service. The second thing is, we do not stop the patient from seeking second opinions, whether it is within the hospital or whether it is outside the hospital. So we have their case summaries ready, up to date, every day at 9 p.m. So at any time, if they ask us, say at 6 o'clock in the morning, they come in and say, okay, we want to take a second opinion. We update it till 6 o'clock and we give them within 5 minutes. We give them their case summary. They can take it out, they can go anywhere, and then they can take a second opinion. So this also engages. So this requires a little bit of tech, because we need to keep the hospital record, the EMR updated. But it gives a lot of, it makes the patient feel a lot at ease that, we are not hiding anything. Because generally what happens is, people generally, when they come and say that we want to take a second opinion, everybody starts running helter-skelter, thinking that, okay, now what is going on? What's going to happen next? But if you're confident about the care that you're delivering, I don't think there is any problem in seeking a second opinion. And we actively encourage patients to seek second opinions. Even if you have two consultants within the hospital, between them, if we don't have the second consultant, they can seek elsewhere. So these are the two things. Again, I said, one is my patient getting the right treatment? And the second is my patient not being overbilled? So in these two areas, when we have improved our transparency, when we have said that you can approach anybody at any time and ask for these two things, the patients are at ease. They are not thinking about that. They're concentrating more on getting the patient better and taking them home. That is one thing. And like I said, the first thing is we approach the patient. Every patient that comes into our OPD gets a call. Our IPD patients get a call every day, and after 15 days after they leave, because usually sometimes patients don't talk about what they're having problems in their treatment, fearing that there might be repercussions. So we call them 15 days after they leave. so that they're at more ease and they can speak about what they've experienced in the hospital. So these are the things that we generally try to keep in touch with our patients. And I think that has helped greatly in helping us spread our word much better than any social media or any advertisement that we may give. These things are word of mouth. We have lots of patients who have come in and said that, oh, so and so was treated here, and we found that these are the nice things that you do, and that's where we've also come.
Thank you, Dr. Raj. Due to time issues, I'm just going to move to the questions. And Suresh, I'll need your assistance here. So there's a question from Soumya who says, how can healthcare providers balance the use of digital tools and technologies while maintaining the personal touch that is crucial for building patient trust, especially among older or less tech-savvy patients?
I think Dr. Raj elaborated this quite a bit. That allowing for time for consultation is one of the key things. Sanjay also mentioned language. I think as being one of the key things. Dr. Sanjay mentioned that language and understanding cultural barriers is key. I think age is an important factor, but it's more about our ability to understand and listen into the patient's needs. I do think that. It's not about whether they are a senior citizen or whether they're coming from a rural background. I think people are intelligent enough to take care of their own health. They understand what is being said, I think, in fairly well and quickly. But time and the fact that you respect the patient and the family and explain to them in an empathetic manner is, I think, the key. Digital channels can become barriers. So using the digital channels to further these objectives, I think, should be the priority for any institution.
Okay. And there is another question that came in earlier, and I'll sort of go around the room. Which is a single most important factor that influence patient trust in the digital age? Harish, I'll probably start with you. What do you think is the single most factor?
So it is just discussed so many times. It is the discussion and communication with the patient. That's the single most important thing.
Are there any other points from any of the other speakers? Sanjay, you're on mute.
So I will here try to little mix it, because when we talk about the communication, which is the most important part, but the end of the communication, the idea behind the patient communication is the trust. Who builds a trust with the healthcare provider, a consultant, and for this trust building, he has a communication. Certain time he presents in the form of language. Certain time he presents in the form of very strange words. You will not believe that Dr. Raj must be facing it. Some patient comes and says that I'm facing some gudu gudu in my stomach. Now tell me this language. It is very difficult for you to interpret, but it is a matter. Communication is not only in the formal language. It can be in the form of the certain sign. It can be form of the certain expression. It can be just to build the trust with the consultant. But the base is communication only. But behind that, patient want to assess that am I at right place? He want to build a trust. Am I in right hand, safe hand? And the third thing is that he come with the faith and information. He want to reconfirm that I will be all right at the end of the day. So I think that is a communication based on trust, or trust based on communication. You can, whatever the way you want to present it.
Shivan, if you can allow me, I would like to add a line to
Sure, sir.
this. One of the very successful clinician with the roaring practice, when I asked him what is the secret of this, then he shared a very good insight. He said before patient leaves this consultation room, he asks a question: do you have any doubt or a concern or a question for me before you leave this room? And that's more than enough. So if you're resolving all the doubt question of the patients, that creates a lot of trust. Thank you, Dr. Sanjay.
Okay, I think that's a wrap then. And as you all are healthcare providers, I will not take up more of your time. You have very important things to do. So, but thank you so much for giving us an hour of your time today. It was a wonderful discussion. Look out for posts from us across social media, what we discussed. We'll have snippets of it coming up very soon. Thank you, Harish. Thank you, Suresh. Thank you, Dr. Raj. And thank you, Dr. Sanjay.
Thank you so much,
Thank you,
Vani.
Thank
Shivani, and
you.
thank you, everyone.
Thank you.
Thank you.
Thank
Take
you.
care. Bye bye.